In this video, we are going through our top 3 exercises for runner's knee. Hi guys, Unimar here from EverStrong Therapy, your partners in health and performance. Today, we are going through our top 3 exercises for runner's knee. Runner's knee in particular is used to describe a plethora of conditions associated with knee pain in the front of the knee, and usually that's associated with things like running or bounding activities. So if you participate in a sport or activity that involves a lot of repetitive motion, particularly ones that involve weight bearing and absorption, resorption of impact, and you have knee pain in the front of your knee, chances are you're gonna look up some stuff and they're gonna tell you that you have runner's knee. The 2 most common specific musculoskeletal conditions that are quote unquote runner's knee is IT band friction syndrome and patellofemoral syndrome. So these exercises that we're gonna go through today are gonna be treatment protocols that we use to treat those 2 symptoms. If these exercises don't feel right or if they aren't helping your symptoms, I encourage you guys to go seek the help of a healthcare practitioner that you trust. If you live in Bellingham or Whatcom County, you can give us a call. We offer a free 30-minute consultation to anyone interested. And with that said, let's get to the exercises. Welcome to the gym. Now, when we're talking about runner's knee, or like we talked about, one of the 2 common issues that are associated with runner's knee, the first thing we need to do is calm the system down and put some slack in some muscles that might be tight. So when we're talking about iliotibial band friction syndrome or patellofemoral syndrome, those tissues tend to be either your IT band or your quads. But I want to make a few adjustments to make sure they're as effective as possible for you, especially if you want them to translate into actual functions. When most people try to foam roll their IT bands, they tend to get on the side and they just roll back and forth. Not the most effective, especially when we're talking about incorporating movement. What I'm going to do, I'm going to put this leg here to support my body weight, and I'm going to try to roll up and down, and I start all the way high, just under my hip bone here, and I'm going to try to find those gnarly or tight spots. Once I get there, like let's say I find one here, instead of just moving up and down over it, trying to make it feel as good as possible, I'm actually gonna hang on this tissue for a little bit of time. Before I take the pressure off, however, I'm going to then bend and extend my bottom leg, right? So if I'm working on my right leg, I'm on a gnarly spot on my IT band here, I'm going to start moving through some flexion extension of my knee in order to floss that tissue underneath with the pressure on top of it. This can be done with the IT band, or you can also do this with the quad. If I want to get onto my quad here, I can do the same thing. My other leg is just helping support my body. I find a gnarly spot, I hang on that tissue for a little bit, and then I'm gonna flex and extend my knee in order to help mobilize that tissue right in the spot where my body needs it most. Give that a try. On to exercise number 2. So for the second exercise, after we've done all the mobilizations of our quads and our IT bands, what we want to start doing is targeting our glute medius, which is our external rotators of our hip. For that, we're actually going to do some lateral stepping or some sideways walking. What you'll see in most gyms is people will take a band like this and they'll put it around their thighs. Instead of doing that, we're actually going to put it right around our feet or right around the balls of our foot. And what this is doing is it's going to bias that external rotation. It's going to give us more resistance in the movement that we're trying to strengthen. From here, I'm shoulder width apart. I'm going to give myself a nice little hinge here, right? Athletic stance. I'm screwing my knees out, and all I'm going to do from here is I'm going to walk sideways, and I'm going to do about 10 to 15 repetitions here. Couple compensations that I want to avoid. I don't want my knees to cave in here in order to help with this movement. I also don't want to translate over all the way, right, in order to accomplish this task. I want to stay nice and centered throughout the movement in order to control and activate my glute meats. Give it a try. On to exercise number 3. So for our third and final exercise to treat runner's knee, we're actually going to be doing a lateral step down. All I need is a box or a step or something that is an elevated surface. So what I'm going to do is I'm going to get on this box. I'm going to slowly squat down, really trying to focus on my control here, tap, and come right back up. So right now we're working my right leg. I'm gonna come down all the way, tap with my heel, and drive using my glutes and my quads all the way up. What this does, it allows me to really isolate control and to work through almost like a full range of motion for a single leg squat, using my quads, my glutes, my ankle. It uses the entire system and helps me track that position effectively. If there's any positions that cause pain, or if there's any positions that I'm not moving effectively or efficiently, so that I can start to isolate and call those things out with other exercises. Give it a try, see how you feel. On to the outro. We hope you guys found that information useful and that it helped you guys with your runner's knee to help you move and feel better. If you have questions, or if you live in the Bellingham area and want to schedule a free consultation with one of us, we encourage you guys to give us a call or visit our website for more information. Thanks so much, stay ever strong, and we'll see you next time.